All good, all good.
So, what are we going to discuss today?
So, good afternoon, everybody. This will be our episode number three of our Indi Cast series, and today we are talking about a very wide topic, a very wide-ranging topic. It is about the challenges with respect to India's public policy uh, and the challenges as laypersons or as readers of the newspaper. uh,
Are the common citizens of this country?
Absolutely. We will be discussing how difficult it is to effectively deal with institutions related to public policy in India. So, uh, right off the bat, these are very vague sounding concepts. So, we will start to break into how they affect our daily lives. So, it is evident that we need to have institutions and tools that bring about changes in our public policy every day so that we can develop as a nation, so that we can have thought provoking discussions, so that we can contribute to the health, education, and basic services of the average citizen. So, you cannot have this discussion without addressing uh, some gaps that may exist.
My thing is, like as a citizen of this country, I want a comfortable living. For every little thing, I don't want to go running pillar to post. I face a lot of issues, a lot of issues.
So I think that this may be because a large section of our administration is a status quoist. We let things be as they are. In Hindi, as you say, जैसे चल रहा है चलने दो. You cannot hand power to anybody without withdrawing it from anybody else. So I feel like why red tape culture has continued a lot in India is because a lot of vested interests don't want to hand over their power. And as a result, handing over your power would mean empowering the average citizen. And that would mean letting go of the status quo. So we are all status quoists to some extent. Mom and I, we have a fairly, from relative to Indian standards, we have a fairly comfortable living. Fairly comfortable is an understatement as compared to the rest of the country. We are well placed. Yet, uh,
It's a
once
struggle. Survival is still a struggle at every stage. Because, whether it comes to civil amenities, whether it comes to a simple thing like promoting your own book in a world in the World Book Fair, everything there was, I realized everything I needed a recommendation from somebody. I needed somebody to put forth my name, whether it was, uh, it's a newly constructed house, so whether it was getting all kind of clearances from various departments, I needed to go through a wire channel. Nothing came to me because I was rightfully seeking what was due to me. Everything required a VIP endorsing my name and endorsing my reference. That is how I have struggled to survive and do my
So
work.
the point we are trying to make is that I guess there's so much struggle when you belong to a fairly high degree of privilege. What is the status of the average person who does not even have the position to make some calls, who does not have the endorsement of 7, 8, 9 VIPs, and how broken is the system on the ground level to ensure delivery of public services. Now, I'm not trying to make a political point here. We are not trying to launch an attack on anybody or any political party, because I feel like at the higher up level, the idea is to help the person on the ground. But once you get to the bottom level red tapes, that is where the real problems arise. Ma, do you have anything to say about it?
I would like to say something that, it's said that the blind man doesn't know what he is missing on. So, if you ask my generation who has seen total abysmal darkness and total lack of functioning of any civil amenity and administration. And let's not forget that I did not really grow up in the metros. I grew up in back and beyond of small states of the country like Jharkhand and Bihar. So what I see now is like almost getting the dream kind of India served in platter to me. But having said that, like he just said, it's only how all the facilities percolate down to the lowest rung, so that it is easy for a commoner in this country to survive and exist without complaining, without actually falling into looking for a VIP to endorse you, or warming people's hand by bribing them. I think these are, I'm not, this is not a blanket statement, but yes, I had to rely on somebody in, giving my reference to people concerned in issuing licenses, issuing something like, the Bijli ka meter and all that. But at the same time, there are people who probably get it done by paying money. But again, like I said, it's not a blanket statement. There may be some
No,
departments who are
but
doing a very good job, but still
I
the
think what
stark
you're trying to
reality.
highlight is it's a remnant of a license Raj kind of system
Yeah,
still
yeah.
essentially,
It'll take
because
time to go, like I
where
said,
you
yeah.
have people who can afford public services by paying bribes,
Hmm.
or you have people who can influence public services by making calls. So
Yeah.
there are only two of these options which can live comfortably. The
Hmm.
option 3 is to kind of bear the weight of the state apparatus, which will in some ways ignore you, not provide you basic services, and as a result unconsciously oppress you if you don't have the right contacts or don't have the right money. And that is the real problem we are trying to address here.
But let me still add, it's not a blanket statement. There's still some departments who probably are working very conscientiously. But having said that, we still face the problem that we've just stated.
So the thing is that, like I said, the department or some bureaucrats, some officials, some politicians might be working very conscientiously. The issue is that the translation to the man on the ground is not coming. So we always say that public policy in India is good because some policies are conceptualized well and they are not delivered effectively. But how good is the conceptualization if you're not factoring in the delivery of public services?
Absolutely. As a youth of this country, like I feel I'm jaded. I've lived on this world, on this earth for 5 decades. What is your solution? Do you have any remedy on mind? What do you think would actually lead to India? See, it's already a very good India that we are living in. Believe me, I have seen, like I say, I'm here for 5 decades. We are seeing a very good India. But as a youth of this country, what remedy do you suggest? Because I really don't believe in, sitting and crying and whining about government not doing anything for us. I also feel that there should be a self-help mode or self-help module. Do you have anything on mind which can be recommended, implemented, so that, things get a little better? Like, for example, we have a very bad approach road. So we've all come together and thought of contributing money, hiring a contractor, and getting a nice road made so that the approach to our fairly nice houses are better. So this is the very layman kind of a solution to the problem that we are kind of
Yeah,
creating
but
for
it's a
ourselves.
layman problem, but it is the one of the
Layman
common
solution, I
no, no,
feel, yeah.
that I agree, but it is one of the main problems that mostly people feel. After all, we engage with our municipalities, we engage with our
We
local
pay all our
legislative
taxes.
assemblies.
We pay all our taxes. We
That is
pay.
a different issue, but
Yeah.
we engage with our legislators, we engage with our parliamentarians, we engage with our bureaucrats mainly to solve your day to day convenience related issues. So the issue here is that the RWAs don't function effectively.
They don't
there
function
is
at all.
there is a funding mechanism which has been frozen due to certain reasons, and as a result of which the internal development fund or the external development funds, whatever as a homeowner you are to pay to your municipality, has been frozen for decades now. So it is the money of the contributor, the money of the resident, which has been frozen by the state. Now, certain important questions need to be asked in situations like this. What is the legislative sanction that the state has to do things like these? How long should a dispute or an issue like this take? How poor are the dispute resolution mechanisms of the country, where you have people who are contributing thousands and thousands of rupees on a monthly basis, and all that large pool of funds can be frozen for so long without us having the right delivery of services. how, how it translates to a poor quality of living is that roads are poorly constructed, so every time it will rain there will be more puddles, which will mean more mosquitoes, which will mean possibly a higher disease burden. So everything in a public policy challenge is interlinked. It is a mind map. And when your dispute resolution mechanisms are slow, the resultant delivery of services is poor. It is almost like a market failure, but instead of allocating economic resources, you're allocating public goods or public services. So it is. So my apologies. I kind of went on a rant mode, but these issues need to be addressed. My mother works in real estate primarily because she's done a lot of estate management here in other areas. How has your experience been, Ma?
You summed it all up very well. It's been a struggle at every juncture. So, I mean, like a small thing like, it's not my problem that I bought a piece of land thinking that this piece of land, which I'm buying in an authorized colony, that colony may have some hidden problems to it. So in 2003 we invested in a plot, only to realize in 2020 that many of the plots in the so-called colony that I'm talking about were sold multiple times. It was not my problem. Now there's a blanket ban on construction of a lot of plots. Now, because of the blanket ban, what's happening, that despite, like he said, that we paid internal taxes and external taxes talk about the laying of lampposts, the laying of footpath and the road. So despite all those things being in place, there's no maintenance happening. And though this is a residential area, but because some people are not allowed to build their houses, what they have done, they have started renting out their plots to some people, like mechanics. So your approach is always inundated either by cars or by motorcycles, and maybe there's a store like Zomato, Blinkit behind your own house. These are, again, let me reiterate, these are all supposed to be residential houses. Now because they are not allowed to build the houses, they can still rent out their plot. So they are renting out their plot to people who actually just congest the whole area. And instead of getting a semblance of a residential house, we feel that I'm living in midst of a bazaar. So this is something that I find. I mean, it's discomforting. Though I've learned to live here and I've made friends with everybody whom I'm so-called complaining about. But having said that, it's still discomforting, very discomforting.
So there is an issue with the man on the ground or the woman on the ground who is doing a lot of licensing work, I feel. Because now in today's day, the politician, the top bureaucrats, they will have the right idea. Many a times you can approach a politician, and many of them are very seasoned now. I think we live in fairly good times. When you talk about there used to be a sentiment that our politicians are not educated, but in today's day you live in times where I feel like that hypothesis will not hold true. Your legislative assembly members, your members of parliament, they will at least hold a bachelor's degree, if not a master's degree or a law degree or a PhD. So they will agree with you. They will have an issue brief. They will know these issues somewhat better than you. But when it comes to policy making and implementation, the man on the ground or the person or the woman on the ground will not be a good implementer, if that is a word. There is a gap in this system. We are not pointing our fingers to the top rung. The system has already become fairly top heavy with good minded people there. their good intent is not translating on the public service delivery that we have to face.
Do you think it has to do with the administrative level failures more than we addressing, we trying to figure out whether it's a political lack of political will or lack of political wisdom? I feel it's more of a folly at administrative level.
Definitely, there is an administrative failure at some level. It is going to be a hard to probe, and any think tank or academic organization who does this professionally should do this. And the research brief should be that where at what levels do these failures sort of like seep into the system. There is a very common practice. It's not even a secret that in Delhi, NCR, other places, whether when you want to start construction of a building, the local station house officer or the inspector, police inspector of your area will take back bribe to allow you to set up a bore for your water supply. So something as essential as a water supply is not something you can set up in your own household without paying a bribe.
And one, let me add, if boring is illegal, then there is no water supply in the colony which is supposed to be authorized. There should have been they should have laid the pipeline. The water supply should have been consistent. Yet, but because you have invested all your life saving in a plot, you're on the verge of retirement, you have no other place to go but for the plot that you bought, so you've built a house because you have no other place to build your house, and you can't go on paying rents worth a few lakh of rupees in the sarkari houses that you were living in before you made this transition of shifting to your own house. So now you don't have money to actually look for a new place to settle down in. So you're caught up in this catch 22 situation where everything is lose lose. So now you have a plot where you've invested all your lifetime saving. You've built a house because you've no other place to go to, and but this the plot which was supposed to be in an authorized colony doesn't have the basic of a water supply pipeline. So what you do, because you have no other place to go, you built a house, and now because there's no water supply, and water is so essential for your existence and living, that you have to make a bore. So even if it's illegal, everybody has a bore around you, everybody is living through the
So,
bore.
as a result, what are you doing? You're draining out the groundwater tables and the reserves of the area that you live in. So, everybody, by making a bore, by paying these bribes, is draining into the groundwater system levels. And if you are not able to do that, you will have to set up a tanker. And if you have poor roads, that tanker is going to get stuck somewhere in traffic.
Yeah.
So, again,
And the tankers have leakage, so probably the whole road, which is unformed, will be full of puddles every day because the tanker is kind of inundating the
and
roads
those
with water.
puddles will allow mosquitoes to be bred and will increase the disease burden in your local area. So, as I said, every public policy issue is intimately tied to one another. So, failure in one will eventually lead to failures in other aspects of public policy as well. I have been trying to assist some of my distant relatives getting an appointment in a very popular government hospital, and the system of allotting appointments and the system of the doctors coming in and going out is so inefficient because the number of people who queue up outside these hospitals, you should go and check. Every morning 5 a.m. the queuing up starts. The queues go outside, all the way outside the buildings up until the main road. And if you show up at 5 a.m., you might somewhere come around close to meeting the doctor at somewhere around 12 p.m., and where he might see you for 2 3 seconds. It's going to be a small chamber crowded with 4 5 people, with one gatekeeper who will not treat you correctly, which is not, the overall experience is not good when you are already suffering from disease. The state apparatus at the ground level makes it all the more harder. So there is
And
a
we're talking about disease like, somebody is suffering from maybe cancer, of,
somebody might have a brain tumor,
brain tumor,
somebody
somebody
might
may
have
have.
somebody might be waiting to get a stent inserted in their arteries, or I'm not going to get into the medical details, but these are intense diseases, and intense, the disease burden is intense, I do not fault the doctors on the ground because the public resources are so limited. You can have this conversation with them, and their idea will probably be that, listen, this is the number of staff we have, this is the number of doctors we have, this is the number of rooms and machinery we have, and the number of patients that we have to treat is way higher. There is a huge lag or an inconsistency there also. Now these issues are also somewhat related to the overall social infrastructure of the country. The voter, the average human being, it affects us. So highlighting them and how to correct them is a duty of everybody who's a keen watcher, for the lack of a better word, of public policy.
Here, I would like to add something that I don't say that the infrastructure in the states are any more as bad as we have seen. We have seen the times where probably the doctors wouldn't even turn up for days and days and months together. And probably even if somebody was, people actually, those were the times. And again, let's not forget that my reference point here is the the so-called impoverished states of the country, like I just said, Jharkhand and Bihar. So people preferred depending on a quack than in a doctor in absentia. So my point here is that in this new changing India, the doctors and the medical system has become much better than what it used to be. But having said that, we have not been able to elicit that kind of a confidence in the gentry, in the common people, that they should go and trust the doctor next door. Instead of trusting the doctor next door, they make a beeline to the metros. Yes, I agree that most of the facilities that you get in the metro of the country are incomparable to what you get in the small states and the B towns of the country. But having said that, all the issues that are, I mean, people with different issues, all the people who are making beeline are not exactly suffering from the problem that has to be dealt in metros and the facilities that is being delivered in the metro. So nobody stays back to their state capitals or to their, district headquarters and meet the doctors there to get their ailment or issue addressed. They all make a beeline to this
That's a
place.
very important point, that
So
there is a trust deficit to local
huge
doctors.
trust deficit, and something has to be done to to
To
address that
overcome that.
problem, yeah, to overcome that. So this influx to the metros will cease, will stop to a large extent, I feel.
Now, I might feel that this might be related to appointment, training, and education of doctors. I am in no position to judge how effective that is, but I'm sure, as any other aspect of public policy, there might be shortcomings in medical education as well.
Actually, I'd like to add something else. There was a common refrain when we were growing up, or when we were in teens or in our early 20s, that Indians don't value Indians because we are so many of us. Like we would like to believe that there is no value to human beings because we are so many. Like कहते थे हिंदी में कि गजबज गजबज चारों तरफ तो इंसान है, तो who's going to care about so many human beings? But my friend just now discovered that her brother, after his 50th birthday, was diagnosed with pancreatic cancer. Now, this friend was appalled by the negligence that she faced at the hands of the doctors, who were probably the elites in their business, who were supposed to be the best. Like you go to them and you come back alive and you come back rejuvenated and
So these are the
resurrected.
top reputed cancer doctors of
And
India.
this friend that I'm talking about comes in the creme de la creme of the society. She is super privileged, like everybody is either a bureaucrat or a politician or a
Rich
whatever,
businessman,
rich
like
businessman. So they have
they
no
have
issue.
influence
Very,
basically.
very, very influential people. So they have no issues when it comes to getting in touch with the so-called best. But despite that, she is very uncomfortable because she feels that the brother is deteriorating every day, and the doctors point blank tell them कि chance नहीं है, आप जान लो कि 5 months हैं, and blah blah blah. Well, whatever happens, it happens. Now all of a sudden, now they're collecting money. They're thinking of selling land, they're thinking of selling properties, they're thinking of breaking the FDs and their mutual fund and blah blah, because now they want to take the brother to the US, and the expense to the US they estimate would be around 4 cr to 5 cr. Out of the blue, they get to know about the similar services or better services being offered in China, and through a first-hand account of patients who have recovered in China was that in India they were told that they will not live beyond 5 years, 5 months, but they have been living on this earth for 15 long years despite being treated in and after being treated in China. So now the point that I want to draw here is that it's not a lack of respect for the human being because we are so many in number. China again is a country where till a few
Hmm.
years ago they were
It is the
the
only country
most
that comes
populous,
close in
yeah, in
population terms.
population.
For
And now my friend is in China because she got to know of these Chinese doctors and Chinese and a lot of Indian politicians who you get a rumor of ki they're suffering from cancer, and suddenly they're walking back like youngsters feeling absolutely walking as if they have suddenly been pumped in with energy and all that. I'm told these may be conspiracy theories or whatever, but I'm told that they all go to China for their treatment. So the treatment that would have costed around 4 cr in US, they are getting the same treatment in 50 lakhs. And they're sent with a surety that you keep on telling us whatever at a certain period of time, and we'll call you only if you're needed. So it's literally that you're being repackaged with the expiry date of another 15-20 years attached to you when you were given 5 months of living time. So there has to be where is the slip between the lip and the cup? I won't be able to identify. But isn't it
that is not our job also.
ludicrous? Yeah, isn't it ludicrous that I've lost somebody very, very dear to me in hospital negligence? And so, as for a doctor, maybe I may be patient number 1 millionth or whatever, but the person that I lose is my only whole and soul.
There may be
So
a
this
lack of empathy,
negligence, this lack of, I know a
a
friend who says
significant
that.
lack of empathy.
Absolutely, I know a friend who claims that she plays Candy Crush when somebody is narrating their problem because they're so tired and so done with the kind of
Your
similar
friend was a
problem.
doctor.
The friend who's a
The
doctor.
claim
Sorry,
is
I
the
didn't bring.
claim is that for the lack of a better word or for lack of empathy or for whatever, the doctors might actually be playing Sudoku or Candy
Candy
Crush while
Crush
patients might be
behind the
lining up.
table, and a patient sitting opposite them is actually narrating their woe stories because they're
Now, this
suffering.
is, don't get us wrong, our attempt is not to malign doctors.
Not at all,
There
not
is
at
a,
all.
there is a lacking public policy or state policy
We must say that then,
effort,
yeah.
effort that we need to identify. There are millions of good doctors, a few of them known to us, many of them I rely on daily as somebody who's very health anxious. But this is about how institutions deal with public, and some doctors may be playing a role which can be reformed in the whole setup.
Or are we talking about these multi speciality hospitals where I
They
feel
are
the slip?
institutions.
They're
They are
institutions.
institutions.
You go to a public, you go to that old, erstwhile, old school kind of a clinic run by a particular doctor, and you have a friendly relationship with, they're gods for you, believe me. I mean, I, I kind of, I lay
Yeah,
supine for
big
this
shout out to
institution.
the family doctors.
Yeah,
If somebody is
absolutely.
going to save your life and care for you, it
Is
is
your
your
family
family
doctor.
doctor, your friend,
Yeah.
your father's friend who became your friend, and they have their own family clinic. They will, in a country like India, they are your only hope. They are your last hope.
And the multi-speciality, I feel they should be avoided. I've had such bad experiences. I've lost my own husband because I am not going to name any institute or hospital, but when I lost him, a lot of fingers were raised against that multi-speciality, but I felt that those fingers were being raised at me, so I got a little defensive about the institutions, thinking that probably people are trying to tell me that I took him to the bad place. But now, when I look back in hindsight, I feel I took him to the best place thinking that I'm taking my husband to a place where he will be protected, he'll be taken care of, and he'll be sent out alive. But that didn't happen. And it was dengue. It was not that he was suffering from, and dengue, we've been dealing with dengue for almost 15, 20 years now. Why was it so difficult for a hospital which is said to be run by the best in the business, and the best of the business are heading the different departments? Why is it that something like dengue could not be treated? Why is it that when at 4:30 in the morning it was reported that he suffered a mild brain stroke? Why the reporting that happened at 4:30 in the morning was actually dealt with at 9:30, after maybe 4 5
Crucial
years?
time is
The
lost.
crucial time is lost. So what
Procedures are not
was a
well
brain
established.
stroke, a minor brain stroke, turned into a massive brain hemorrhage? So if I take my husband or my dear ones to a multi speciality, I'm drawing the strength from the fact that all the different specialities are working in tandem with one another. So maybe it's a brain stroke or a cardiac arrest, or maybe it's some kind of an internal bleeding. There is system established for you to intervene and take care of it immediately. But here is a brain stroke which turns into a huge, massive brain hemorrhage, just because what was reported at 4:30 in the morning was being addressed at 9:30 in the morning again. So these, where do I go and complain? What do I talk? Who do I talk about it to? There
These
has
things
to be.
again. This is not finger pointing. Life and
That's
death
why we
in
are not
many
blaming
life and
anybody.
death in many ways are a matter of fate. Is that there is a lacking trust on government doctors. Maybe there is a lacking trust on rural doctors. The result on big government institutions in Delhi or Bombay and on big private hospitals in NCR is a lot heavier. Their operations are also circumspect, probably not the most efficient, which can be probed, corrected, reformed. Suggesting these measures is our only attempt. Suggesting reform in these institutions is our only attempt. That is all we are trying to say.
So the takeaway from today's conversation is, first, always have contacts in bureaucracy or politicians.
Or
Second,
really big businessmen
or really
who
big
can
businessmen.
bribe.
The second takeaway is, if you don't have a family doctor, it's not too late to go and find some neighborhood doctor who knows your medical history and you have friendly terms with them. I cannot name the doctor, but thank you so much, doctor, for being in our life, for looking after us for past 3 years. The confidence you give us is the confidence probably even God can't give us.
And finally, the last takeaway is that we begin to have conversations on how to turn public policy in this country into a setup where you don't need patronage from big politicians, big bureaucrats, or big businessmen.
Yeah.
And
So I was just being sarcastic.
nothing against these three variety of people. Good for you. But how do we make the average citizenry uh, more comfortable, especially mainly in social infrastructure, because after all that is the one thing that affects our day-to-day life. Everything else can be managed or pushed to another day, but your health, education, logistics, transport, these are things we need on a daily, and people would prefer to get this done without state patronage, and that is the real lacking variable that we need to change.
And I am a I'm very patriotic. I'm patriotic to the extent of being mushy. So I want to see an India where an average human being, an aam janta, is as comfortable as anybody with any kind of privilege. Jai Hind, Jai Bharat.
Thank you.